So what is Acacia? Acacia is the heartbeat of our communities. We feel so proud to be able to provide high quality services when it comes to primary care, mental health, housing.
We provide substance use disorder treatment, skilled nursing.
It'd be so much easier to actually detail what we don't provide.
And we try to do all of that in an integrated manner.
The Acacia Network, by having this holistic method, is able to change the lives of everyone who comes in through their doors.
There's no place like Acacia.
We provide anything that the community needs as far as harm reduction is concerned.
And I don't think there's any other organization quite like us.
There is always a solution that can be found through the Acacia Network. If not through one of our direct programs like the CCBHCs, through one of the many other early intervention programs, through primary care, through long-term, short-term housing.
Our goal is to provide the highest quality services to the communities that we serve, communities that traditionally have been underserved and underrepresented.
Predominantly communities of color.
We want to make sure that they have access to nothing but the best.
By the way, 103 affiliates, and all of them come with a rich history rooted in the community.
Being community-based, understanding what they're hearing back from people as well, that we're able to provide those types of services, and not just individualized, siloed services, that we're able to provide holistic methodologies, that we can have people that do wraparound services that perhaps need a little bit of some intervention and a little bit of another.
We do so much, and there's innovation in the industry, and we want to make sure that we bring that to the patients that we serve.
We're constantly looking at new product lines, new ways of servicing our community, new ways of reaching out to our community. So what is ahead of us? It's enhancing what we have been doing for decades.
Too often you find communities that are underserved receiving modalities of treatment that were the norm 20 years ago. I think it's imperative upon us, an organization such as ours, to make sure that we are utilizing the newest best practices and clinical guidelines that are available to us.
If you provide services for somebody and you address their diabetes, their hypertension and HIV, whatever it is, and you ignore the one thing that will kill them tonight, which is a drug overdose, then that will keep me up at night.
The MMU is a mobile substance use disorder treatment vehicle. The goal of that is to bring treatment to areas and to individuals that would not otherwise come into the four walls of our building.
So we're bringing those particular services to them.
The first one has launched, the Bronx MMU. It's positioned at a homeless shelter, so the audience that is high need is there.
We have hundreds and hundreds, thousands of individuals throughout the network that are being provided those services now, including the mobile methadone. So it's very, very, very important.
We're able to do methadone maintenance on the mobile unit. We're able to prescribe other modalities of substance use disorder treatment.
MAT is not necessary, it's critical, and saves more lives than any other intervention known in medicine, plain and simple.
We're happy to be sort of at the forefront leading that for the state and really for the nation.
We have multiple resources available as far as that's concerned, and the expertise is there for the asking.
We received a referral from a parent about their teenage child, and they were concerned about substance use. One of the concerns that they had was having appropriate, culturally sensitive, millennial-focused interventions for someone for substance use. Thankfully, within the CCBHC model, we're able to have that intervention for this high school student, this child. But along the way, we also realized that the parent themselves were struggling, that they were going through some transitional changes themselves. And so during that time, we were able to also offer services to the parent as well. Again, it was this wraparound method and this wraparound idea of how are we going to be able to better improve the lives of the people who come through our front doors.
Mi nombre es Urbano Sierra, tengo 5 hijos. Jesús, que es el bebé de la casa, ya tiene 17 años. Él había estado aquí recibiendo terapia porque ya empezamos a notar que le afectaba mucho los problemas de familia. Él se encerraba en su cuarto, no salía, no interactuaba con nosotros, y fue por eso que enseguida nosotros buscamos ayuda y venimos aquí. Y empezó a recibir esa ayuda psicológica, y bueno, él se sintió muy cómodo desde el primer momento. Lo ayudó bastante y ahora es otra persona él. Y definitivamente sí recomendaríamos este centro de ayuda Nos hemos sentido muy cómodos, muy apoyados en todos los aspectos.
So when we look at mental health intervention, it's always important to recognize that the lifespan of people evolves. Services should be available for people no matter what stage in life that they're in.
Me siento muy conforme con la clínica. La primera vez que yo vine fue porque murió mi padre, y en la misma semana me murieron 4 hermanos, uno atrás de otro también. Y traté de ver, fui al hospital, me mandan para acá y estaba medio como nervioso, y me han ayudado mucho. Me han dado mucha idea para yo hablar.
Mental health crises are not uncommon in our community, and families and caregivers are looking for a resource.
We actually are able to provide services, for people who are in crisis that don't necessarily pose a danger.
We have the exciting opportunity and privilege to be able to launch 3 crisis stabilization centers.
And which I think is going to be actually a novel intervention as far as New York City is concerned.
When I describe them to folks, I always describe them as sort of a mental behavioral health urgent care center, whether it be sort of a panic or whether it be a psychotic break.
There are very few options for treating these particular individuals. Either they're transported to the emergency department, or they're taken to jail, or they're ignored.
The ER is a very stressful place.
Most of the emergency departments across the nation do not have expertise as far as dealing with crisis.
The Crisis Stabilization Center allows us to direct much of that traffic to these centers that will be physically and aesthetically designed to be comforting and to be staffed by qualified healthcare professionals that are compassionate and caring.
We're talking about massive amounts of individuals who require those services, and to provide a safe haven and the resources necessary to bring them back to function and to avoid mishaps, as we have seen in so many high-profile cases which involve law enforcement.
The Bronx is a very densely populated borough, so there's no shortage of individuals that find themselves in crisis from time to time that will need to avail of those services.
It's critical, again, simply because of the fact that it has never truly existed as far as de-escalation is concerned.
It allows room for further innovation, but really brings a modality that is much needed into the communities that we serve.
When it comes to expanding programs, we have the crisis centers, we have the mobile units, we have the intensive crisis services, we have bridges to care.
And things that are in the pipeline are sort of the innovation of the industry.
So what is ahead for Acacia? Expanding services that we do with our eyes closed. We have over 10 lots that we want to build affordable housing. We have an incredible opportunity to expand services in Puerto Rico.
The opportunity to integrate our services is always an exciting venture.
When you have over 103 entities under your umbrella, make sure that you connect them all. All those leads that are in the Acacia tree need to talk to each other.
You know, we do a lot and we take on a lot to do, and we're going to be doing more because we see the need in the communities that we serve.
Y eso es lo que me gustaría hacer, darles gracias a todos.
Every day is real. Every day we're really affecting people's lives.
That's what wakes us up in the morning. That's what keeps us coming back every day for more, is really the thought of bringing more to the communities that we serve, the communities that we're from, the communities that we have dedicated our lives to caring for.
Yo me siento apoyado con ellos. Me siento que estoy grande ya.
I've always wanted to be able to contribute back to the people around me, as well as improve the lives of anyone that I can.
It's really an exciting and fulfilling daily journey for each and every one of us.
Every day is an accomplishment.
Nothing matters most to us if we don't show the world that people like sound and look like us have a seat at the table, making sure that our communities are left in a better way than the way that they came to us.